case review was given to me by a colleague of mine. It was a 75-year-old patient. And so if we want to go ahead into the next slide, I'll show you the CC projections, and this is in 2D, 2 dimensions. And this patient had a history of a benign biopsy in the left breast, as indicated by a tiny, tiny biopsy clip. But if I turn your attention to the right breast, she actually had 2 irregular spiculated masses in the upper outer quadrant. And the first one is located within the middle third, and then the second one is in the outer third. And again, on the corresponding MLO view, she has 2 irregular spiculated masses again in the right breast. And I'll show you what those look like here on the 3D slices. These are videos of the 3D tomosynthesis slices. The first set of images is the MLO projection, and the second is the CC. So if you want to go ahead and play both of those for me, please. Those went by a little quick, so I'm going to go to the next slide where I have the individual slices so you can actually see what the Profound AI found. So again, this is the larger of the 2 masses in the right breast. You can see the region of interest with the lesion score. And then the second mass in the posterior third, again, with the Profound AI lesion score. And I have the corresponding MLO projections for both of those masses. And this is for the, again, the larger one in the middle third, and then the smaller mass in the posterior third. Now, the radiologist that gave me this case, he said that at this point in his interpretation, he was actually distracted. He got a phone call and was pulled away from the screening desk. When he returned, he started working on this patient's report, describing both masses in the right breast, and then also putting regions of interest around both of these masses so that way the technologist that would perform the patient's ultrasound when she came back would know exactly where to scan. And he did say that he's not sure if he just had tunnel vision from both of these masses or if it was a result of him just having a busy day, but he felt like he probably didn't do as good of a job as he should have looking through all the images on the left breast. So fortunately, we had Profound AI at this point in time. And if you want to go ahead and play the videos, this woman actually has an additional irregular spiculated mass in the left breast as well. And I think it's pretty obvious that the patient does have a cancer here to any of the radiologists that are on the call. I mean, it's irregular, it's spiculated. I don't think anyone disagrees with that. However, it's very, very easy in a busy day with distractions and potentially with large volumes to read that you could easily pass by a cancer. And fortunately, we have another set of eyes that essentially help to improve our confidence in reading our screening mammograms. And then again, this is just the MLO projection of that same mass.